What is the standard of care we hear so often in healthcare? Welcome. I am the medical bill whisperer. A previous billing manager turned patient advocate, I am committed to bringing answers, insights, and solutions to empower patients like you. So let's see what is the standard of care and why you should care. So, what is it? Well, like everything else in healthcare, it depends. From a legal point of view, it means the benchmark that determines whether a professional obligation to a patient has been met. That standard is based on state and federal laws, as well as legal opinions or precedents. The consequence for not meeting standard of care is malpractice. Now, from a medical point of view, the level of care, expertise, and treatment which under relevant circumstances is recognized as acceptable and appropriate by other healthcare providers of a similar practice is standard of care. Although some details may change from state to state, if another medical provider of the same specialty under the same circumstances would render the same level of care and services as you do, then you have met medical standard of care. From a clinical point of view, there are guidelines, regulations, protocols that have been established by the Federal and Drug Administration, state or federal health agencies such as the CDC or Health and Human Services, but professional medical associations, including the American Medical Association, accreditation standards, especially for labs and facilities, as well as specific hospitals, rules and regulations for providers operating at their location. One example would be the National Comprehensive Cancer Network, which has compiled all the information necessary about the appropriate use of drugs and biologics in cancer patients, and which is considered standard of care in oncology. Now, from an insurance point of view, standard of care is what medical policies have determined to be covered and payable. Medical policies do not need to reflect other guidelines or rules, although they mostly do, and they can vary greatly among insurers, one being more generous than another or more current. There are financial consequences to patients, and none is more important than the one from a legal point of view. The fear of malpractice, negligence, misdiagnosis, harm, even patient death haunts medical providers and directs their actions. A tendency to overestimate the risk of rare, improbable events leads to risk management behavior at the expense of scientific rationale. This is called defensive medicine, the ruling out of potential outcomes instead of making a straight diagnosis. Doctors order more diagnostic tests, more referrals, consultations, have more aggressive interventions, including more hospital admissions. And for patients, more services means one thing: more money out of your pocket. From a medical point of view, following conventional traditional medicine is the norm. This means an adherence to established protocol, reluctance to go outside the norm, blind reliance on guidelines and regulations, distrust of alternative options, advocating intervention over lifestyle changes, having limited knowledge and use of other medicinal methods, including acupuncture, naturopathy, Chinese medicine, for example. For patients, more affordable, less aggressive options may not be available or proposed. From a clinical point of view, local medicine becomes standard of care. Location is the determining factor, rural or urban. And yes, rural care will often not be able to meet the same standards as in urban areas. The PCP there often acts as a multiple specialty specialist. Prompt and nearby access to specialty care may be difficult, if at all possible. The availability of supportive services, infusion centers, labs, and equipment, imaging centers or dialysis centers, may be limited, and insurance benefits may be lower, further reducing access and action. So fewer services means less out of pocket, right? Well, yes, but at what medical cost? And from your insurance point of view, the medical policies will determine coverage and therefore payment, even if obsolete or not up to date. An insurance may even alter a treatment plan, force a specific cheaper option, and even deny an authorization or claim based on criteria including cost, which of course they will never reveal. If the requirements listed under a medical policy are not met, it will be denied as not standard of care or not medically necessary. Now, I want to leave you with a point of hope. Standard of care is a fluid term. It can be altered, updated, and contested based on new evidence, updated guidelines or protocols, published documentation and articles, other insurers' policies, legal opinions, and articles published by health agencies. You and your medical provider have the right to appeal any rejection of an authorization or denial of a claim. Basic research should help you uncover evidence and documents proving that a medical policy is not up to date or too restrictive. I so thank you for watching. Your likes, comments, and subscribe help support the channel and help make it grow to reach out to more patients like you. So, thank you.